And we'll get started. Welcome, everyone. Good morning, good afternoon, good evening, depending on where you are in the world. My name is Dr. Ann Smiley. I am the Deputy Project Director for PlayMatters with the IRC based in Uganda, in Kampala. And I am lucky enough to be collaborating with a number of my colleagues from the PlayMatters program today to share some results from a mixed method study of our emergency response mechanism in conflict-affected regions of Ethiopia. And I see some of my colleagues have put on their cameras if they're able to do so that I can introduce them. What we've got in terms of a panel today is we have a team of 3 researchers, which includes myself as well as Tsagaye Lolaso with the IRC. If you want to wave to us, Tsagaye. There he is. And we have Jonathan Kwok, also with the IRC. Yeah, thanks for waving, John. And myself. And the 3 of us are researchers that have been working on the PlayMatters Emergency Response Mechanism and leading the learning agenda around that mechanism. But we're so lucky to not only have researchers on our panel today. We're also joined by 4 of our implementers of the PlayMatters Emergency Response Mechanism. So that includes the rest of our wonderful panel, Johannes Gebrselassie from IRC, if you're able to wave to us. We've got Tilahun Woli from Plan International. We've got Tesfaye Haresi from ChildFund. And we've got Mekdes Hailu from Faith in Action. So this is our great panel that is going to be able to share not only learnings from our research and from our learning agenda activities, but also reflections from an implementation perspective. This is the second webinar that we've partnered with INEE to share results from our emergency response mechanism. The first took place around August, and we shared results from our study on the integration of learning through play in an emergency setting in Ethiopia. Now we're coming back to share our bigger results from the bigger study around how we were able to integrate cross-sectoral approaches into education in emergencies through the ERM. So this is a really exciting opportunity for us to share what we've learned over the past year or so. Can you go to the next slide, please? I'm going to quickly share a background, and then we're going to get into the methods and the findings from some of my colleagues, and then we'll have a chance to do some recommendations and then a Q&A at the end. So a quick background on PlayMatters, if you could switch to the next slide, please. So there's a lot of text on here, and there's also 3 maps, because I just want to give you a big picture of what PlayMatters looks like. It's a 6-year project going from 2020 to 2026, so we're right in the middle of the project right now. We work in 3 countries, which includes Ethiopia, Tanzania, and Uganda. There are 5 partners. The lead organization is IRC, but we also work with Plan International, War Child Holland, IPA, and the Behavioral Insights team. The funder is the Lego Foundation, and the goal of the project is improved holistic learning and well-being for 800,000 children from ages 3 to 12 plus in refugee and host community settings. And our goal is, our intention is to strengthen education systems' capacity to train and support pre-primary and primary school teachers and facilitators to use learning through play as an active teaching and learning method. So the focus here, of course, is on refugee communities for the larger project. And you can see across the 3 countries that we work in the maps on the screen, that we do work in refugee hosting parts of the 3 countries where we are focused. If you could go to the next slide, please. However, when we started the program, we really were not expecting, first of all, the COVID pandemic. So that was the first crisis that hit the program when we began. But we were also faced by the conflict in Ethiopia, which began in November of 2020 and affected millions of children in some of the areas that we were targeting for the project, for the core PlayMatters project, which included Tigray and Afar regions, as well as Amhara. So our PlayMatters Emergency Response Mechanism was a 1-year multi-sectoral response that we funded under the larger PlayMatters umbrella as a response to that crisis. It ran from September 2022 to September 2023. So again, 1 year. It ended just a few months ago, and we're in the wrap-up stage right now. And it was implemented by IRC and Plan, which are two of the core partners for PlayMatters, but also 10 other implementing partners. And that was, again, in partnership with the LEGO Foundation, which is the core funder. The PlayMatters ERM is special because it was an education and emergencies response that integrated education activities as well as child protection, WASH, and health and nutrition programming, all through EIE in the Afar, Amhara, Benishangul Gomez, and Oromia regions in 201 pre-primary and primary schools. So really a multi-sectoral response implemented by a broad range of implementing partners across those regions. Our primary goal was to ensure that crisis-affected children in Ethiopia have their basic health, safety, and educational well-being needs met in order to survive and be meaningfully engaged by the larger PlayMatters programming outcomes, which of course focused on active learning and learning through play. In total, we ended up reaching 177,409 children. If you could go to the next slide, please. I'm going to hand over to Gaye now to take you through the methods. Thank you.
Thank you. And I'll go through the method. When we see the design, this study followed a mixed method design with the aim to answer to what extent this PlayMatters ARM project, improve their basic health, safety, and educational and the well-being need of the crisis-affected children. Primarily, this study focused on qualitative case study design, and we also triangulate with a quantitative data, quantitative analysis, and I will share you later. Please, the next. And when we see the sample and the data collection procedure, the qualitative part of the study, we purposefully selected 6 case study schools across the 4 regions, and in each school we conducted a key informant interview with 1 head teacher, 3 teachers, 1 implementing partner, and we also conducted a focus group discussion. We conducted 1 FGD with children, 1 with parent, and 1 FGD with government system actors per a school. And then we have a total of 86 adults and 42 children participants. The data was collected in 2 to 3 time points from December 2022 to June 2023, depending on the security concern of the locations where our case study schools were found. And the data was captured in Amharic, and for some regions, we also used a translator to other language, and that this data was transcribed and translated to English. Please, next. The quantitative part. For the quantitative part, we used the secondary data from the government or education office, and we have 2 wings, the intervention wing and the non-intervention wings. For the intervention wings, the areas where the PlayMatters CRM project was implemented, and the non-intervention was are schools in which this intervention was not actually conducting or intervening. So to this, we have 128 and 131 schools, and we also match them by different characteristics like school size, urbanity, and location. And we have 2 time point data of 2 time points of the pre-conflict, which is 2019 to 2020 academic year, and the post, after the end of the academic year at which the PlayMatters CRM project was implemented. Please, next. And for data analysis, for qualitative data, we analyzed by Didu software, and then interactive coding framework was followed. And based on the research questions, such as the benefit, opportunities, and the challenge, and we also follow a me coding emerging from each round of data collection of our case study. And for quantitative, we conducted a comparative analysis using two-way ANOVA, and we consider three main variables for comparison. One is the student enrollment, the other is absenteeism, and the teachers' retention, to compare this variable with two wings of the schools. One is the intervention and the non-intervention. Finally, we triangulate the two findings, the qualitative and the quantitative results, together. And this study get an ethical approval from IRB IRC. And before actual data collection, the school directors, whatever education office, provide a permission for a data collection to take place. And for adults, we received an informed written consent before participation, and for children's, we provide informal oral consent before the participation. Please, next. When we came to the finding, this study, we summarized the findings of this study in 7 key categories. The first finding is this project supported the children's physical and social needs, and the providing of high energy biscuits through school feeding, the provision of menstrual hygiene management support, the water point rehabilitation, and the campaigns for vaccination and deworming were the most frequently reported by our study participants. And our participants also discussed the relation between the meeting the physical needs and which have a positive influence on increase in enrollment and attendance at the school, and also contribute for the reduction of absenteeism. And it also support to fulfill their physical need, also support their the quality of learning too. Please, next. And also for participants also described that these projects have contribute to boost their morale for teachers and the students. These interventions primarily contribute for restoring their hope, normalcy, and the rebuilding after the conflict. Some of the participants also described that the intervention have an influence on provide more clinical support through referral linkage to the nearby health facility for those who are in need of mental health and social support. And the rehabilitation activities also have an influence to minimize some of the reminders and triggers of trauma or stress from the conflict. And the other, with this, let me invite Johannes to reflect on this finding. Johannes, the floor is yours. And they will have 1 minute.
Okay, thank you. Just as mentioned by the researcher, this integrated emergency response, education in emergency response has emerged due to the northern conflict. So that the northern conflict of Ethiopia, that resulting in negative effect on the socio-economic and also the damaging the infrastructures of school classrooms, wash facilities, and also damaging the educational materials. And also we observed the unaccompanied and separated children during our assessment. A lot of children are out of schools, and also affecting the the community or the family unable to send their children due to the socioeconomic and also with different reasons. As a result, in collaboration with the government partners, we conduct the need assessment and learn that it's required to have an integrated education response, including the WASH, child protection, and also the health and nutrition. So these conflicts are also affecting the government to provide basic service, including supporting the schools and also the health, this vaccination and deworming activity for children. So as a result, we provide the basic needs of both education, including scholastic material, school feedings, wash facility rehabilitations, and also child protection activity, including case management. So overall, this had brought the children to be willing to stay in the school. So even the learning through practice and the psychosocial support training for teachers and our stakeholders are also contributing a good interaction, a better interaction with children and teachers. That also observed in the classroom, so that at the end we get some improvement on the attendance rate and enrollment, particularly school feedings and MHM provision, the menstrual hygiene management, room rehabilitation and kit provision also have a great impact for school high attendance. Thank you.
Thank you, Johannes. And the second key finding of this study was this PlayMatters CRM project supported students to increase to education or increase access to education. Most of our participants of all groups described that there is an increased enrollment, attendance, and a reduced student absenteeism and dropout. This increment of the enrollment and attendance can be attributed to 4 factors. One is the children's physical and psychosocial needs were met, the provision of the scholastic material and the provision of teaching and the learning materials, the provision of the rehabilitation of physical environment, including the rehabilitation of learning room or classrooms, and the provision of the playgrounds or the play materials. And there is also an increased capacity of educators to implement learning through PlayMatters in classroom. Please next. And participants, particularly parents and teachers, frequently describe that this intervention have contributed to an increased enjoyment at school, desire to attend the school, and engagement while they are at school. So their engagement while they were at school were increased due to the contribution of this project. Please next. And we try to compare this qualitative finding with the quantitative data, and we see that there is an average increment of 102 children per school in our intervention area, while there is a decrement on non-intervention area with an average of 29 children per school. So this shows that the intervention have an impact or an influence to increase access to education, is also confirmed by the quantitative data. Please next. And we also try to see the average reduction on absenteeism. So when we compare the intervention schools, the average absenteeism was reduced by around 2.6%, while on non-intervention schools, it is increasing. And we try to see this increment or is this decrement is statistically significant. So we found that this has the project contributed for an increment on attendance rate or an decrement on the absenteeism rate. Please next. With this, I invite Magdas Talahun to reflect on this finding, please. Talahun.
Thank you, Sagai. Just I would like to highlight on the attributed factors that contribute for the increment of or the retention of students and the increase in enrollment as well as the decrease in dropouts. In our intervention, we try to improve the psychosocial problems or challenges that happen because of the disaster or the conflict that was happened in these program areas. And then to alleviate this challenge, we provided trainings for teachers and other school structures like for PTSS. Therefore, they are aware of how much the conflict affect their children in order to be in the school. And then with providing with the scholastic materials, even after it has, the community by itself has in these areas are poor, and even before the crisis, the community has the challenge to handle the economic cost of the education materials and sending their children to school. Beyond this, when this conflict or disaster happens, the capacity of handling these costs become a challenge for the community. And our intervention has give relief for the families by supporting these scholastic materials for all the children who are accessing the school. As a result, the students are retaining in the school and have continued their education throughout the academic year. Children likes a better environment to be there. As a result, we are, maintaining different facilities in the school compound, including classrooms. As a result, they are happy to be in the school compound. In addition to that, not only rehabilitating the classrooms, wash facilities, and others, we were intervening, we were responding through equipping these classrooms with furnitures, because of this conflict, the schools were used as a shelter for the community, and during that time, most of the combined desks and furnitures were, it's because of that, and then replaced this furniture and other facilities in the classrooms. Not only the students were displaced and affected by this conflict, teachers also affected by the conflict. And then one of the intervention to capacitate teachers to handle students in the classroom, because one of the major factors that the students to be retained in the class is the way how teachers are managing these students who are under trauma or other stresses. Therefore, to alleviate this challenge, we have provided trainings for psychosocial support, and other education in emergency related training. Therefore, as a result of that, students love their school compounds, and they, instead of being out of the school, they are interested to be in the school and continue their learning. Thank you. Over to you, Sagai.
Thank you. Thank you, Talon. And the third main finding of this study was the PlayMatters CRM project supported the holistic learning and the well-being of the students. There was a trainings that they provided trainings to teacher on LTP and the mental health and social well-being contributed to improved learning and the well-being of students. Some of our participants stated or described that improved academic achievement to students were observed on ARM school. So one of our study participants said that at the time this school was screened, our students were labeled as unproductive, and less than half of them able to pass. However, today we believe that they can be more than passers. They can be hope for the village and the possibility to the entire nation. Please next. And our study participants also described that there is an improvement on social, contribution for social community among children, among students, between students and the teachers, and the students now. One of our study participants stated that students now engage in discussion outside school and encourage each other to attend their class, and that they form a supportive network that motivates and helps any student who may be falling behind. This shows that the social networking or social, participating on extracurricular activities and helping each other also improved through by the contribution of the intervention under this project. Please next. And some of our participants also reported that there is an improvement on student-teacher interaction, and the safe emotional environment was created at the school because of the interaction between, as you know, the interaction between the student and teacher is smooth. That could contribute for the safe emotional environment at the school. One of our study participants reported that what the project has contributed to the kids is that they have gotten what they want because they are learning with love. They have not come across mental stress. They are learning with a relaxed mind because their interaction, between the two educator and the learner was smooth. Please next. With this, let me invite Methodist to respond, to reflect on this key finding in the practice.
Okay, thank you, Sagai. Just to proceed, related with this finding, if I provide some key activities, like to provide LTP and MH spaces for 464 teachers in the targeted schools, and also establish social network that enhance social interaction among students and teachers. Just to mention these social networks, we established Child Rights Protection Club, Gender and Health Club, Student Council, Parent and Student, also teachers associations. By completing these activities, we get some results, and like students' attendance and completion increases. We found it by our assessment on student enrollment and completed. Addition to that is enhance the teaching and learning process. We check it by field monitoring and review meeting. And also it's, let's say with this project, we established safe space that adolescent girls use it to discuss, to reflect their idea, and also they use it as for image management. So these girls start to discuss and share their experience in this safe space room. Then school students also start to discuss in each level, like I mentioned above. So they start to claim their rights about to access basic service, at least in school, to get the water service and the latrine service. The other improvement what we get from these activities, it's improved the teacher's communication skills with the student by using a positive word and action that encourage students to learn to come to school. And the other, it's improved also the teachers, student, and parent relationship due to these LTP and MHPSS trainings. As phase in action, we did this experience to other intervention areas, like in Addis also, to get these LTPs to cascade other government schools. Yeah, and thank you.
Thank you. John, with this, I leave the floor to John.
Thank you. So our fourth key finding surrounds the professional development opportunities and the ways in which the PlayMatters ERM supported teachers, retention, instructional practices, and well-being. In that we heard from a lot of teachers as well as school leaders and government actors in which the professional development opportunities through the PlayMatters ERM supported not only teachers' classroom practices, and if you're curious to hear more about changes in teachers' classroom practices, you can look back at our materials on our Learning Through Play Promising Practices study. But teachers also described how these opportunities supported their overall motivation and encouragement, given the minimal other professional development opportunities that they have had. Additionally, we found in the next slide that the PM-ERM also improved teacher-student relationships, as Tagai mentioned before, in which actors and stakeholders described students enjoying school, enjoying their teachers, and having a stronger connection with their teachers, particularly due to trainings on learning through play and MHPSS. Additionally, some teachers reported that professional development opportunities, especially the MHPSS training, supported their own well-being, in which they were able to engage in discussions and deeper knowledge around MHPSS concepts. I will, however, note that MHPSS, particularly around teacher well-being, was noted as a gap in the intervention, and amidst the intervention lifecycle, there were attempts to transition and address this gap, but something to note for the future regarding multi-sectoral education and emergency responses of considering teacher well-being as an outcome in and of itself, given that teachers were also affected by the conflict. Next slide. Similar to student outcomes, as Tagai mentioned, the third variable that we looked at quantitatively was around teacher retention. And we found that teacher retention increased in ERM schools by about 3 teachers retained per year, compared to an average loss of about 1 teacher in non-intervention schools. And this was found to be statistically significant, leading us to further believe that components around teacher motivation and teacher well-being as being very critical to teacher retention within the space. And with that, I will invite Tesfaye to reflect on supporting teachers.
Okay, thank you very much. I am Tasfaye from ChildFund Ethiopia, Senior Project Coordinator for PlayMatters Emergency Response Mechanism. During the course of this ERM project, PlayMatters ERM project implementation, we faced a difficulty from the teachers because the teachers' socio-emotional well-being were also highly deteriorated because of the Northern Ethiopian crisis. Due to this reason, we provided different types of training to retain the teachers and to implement the project activities successfully. From these trainings, the PSS and LTP training is one of the major components that we provided for teachers. As I told you earlier, because teachers were also directly or indirectly participated in the Northern Ethiopian armed conflict. Due to this reason, some of the teachers also lost their children, their students, and they were also traumatized. So there was a need for psychosocial support for teachers, in addition to those students who were suffering from this trauma. So we also included the socio-emotional learning training for the teachers. We provided this for teachers. In addition to this, Talahun and Magdes, as well as Mr. Johannes also explained that making the school environment safe for teaching learning program is also one of the key components for successful teaching learning program and conducting instructional practices and teacher well-being in the school. So in our target schools, we also equipped the school with Montessori kits and establish a separate LTP practical learning center, which makes easy for the teaching learning program for the teachers and interactive way of teaching methodology. So it helps the teachers to conduct the instructional practice in their school successfully. In addition to this, each target schools have also their own focal person, PMRM, the PlayMatters Emergency Response Mechanism project focal person was assigned. And this focal person was also designed a checklist to follow up the successful implementation of learning through play program in the teaching learning activities of each target school. And this focal person also follow up the inclusion of the LTP in their weekly plans. So this is also helpful for the teachers to make easy for the teaching learning program after such a kind of devastating crisis in the northern part of Ethiopia. Now, in addition to this, the teachers in our target schools were also equipped with the teaching learning materials because during the time of the war or the conflict, all the school equipment were destroyed and looted. So we provided a chalk, blackboard, textbook, and combined desks and other basic teaching learning materials were provided by PlayMatters Emergency Response Mechanism project, and this resulted for the retention rate of the teachers that increased in the target schools. In addition to this, as I told you, the teachers were also suffered with a trauma due to the conflict, and the psychosocial support training as well as the peer support that is provided in the school between teachers also help the teacher to come out of their trauma and becomes the healthy and come to the healthy teaching learning program and support their children also. In addition to this, ERM, LTP methodology also attracts different teachers from other area because from other non-ERM schools, because this school was equipped with different infrastructures and more attractive through the rehabilitation activities and other on school-based activities that support the teachers resulted the attraction from other schools and increased the retention rate of the teachers in the school. Thank you very much.
Thank you. Next slide, please. The fifth key finding that we found was that the PlayMatters ERM strengthened local capacities, primarily with government officials as well as with community members. With government officials, we found that actors were participating in and co-leading different trainings, whether it be related to learning through play or MHPSS or protection or different things like that, conducted joint monitoring with implementing partner staff, as well as other experiences of being able to share knowledge about project goals, as well as details around achievements and status of project implementation across the different time points in which we collected data. Additionally, for community members, we found that they were active contributors and collaborators in implementation, primarily through donating either time, money, or materials, viewing their participation as being critical to the success of the project, as well as supporting and building that ownership of project activities. Next slide. We also found that the multi-sectoral nature of this in terms of using the school as a center of delivery for multi-sectoral activities, bringing in child protection, WASH, and health and nutrition activities into education, helped to break down some of those sector-based barriers that we frequently find based off of either funding or activity structures from the sector at large. And we also found that the ERM had strengthened synergies within local government offices to collaborate across some of those sector lines, thinking about joint planning, stronger communication and collaboration between different sector offices, as well as the implementation of school-based trainings, such as trainings for school clubs, as well as joint monitoring of school activities in schools by officials from different sector offices, such as the WASH and the education offices coming together to conduct joint monitoring. And so we found that the multi-sectoral integrated nature of the intervention helped to strengthen the local, in this case, district or WAREDA office level collaboration amongst the different sector offices. And with that, I invite Telefun to reflect on this finding.
Thank you, Jonathan. You know, by its nature, this multi-sectoral approach used to bring different stakeholders together and work collaboratively, and that positively impacted on the comprehensive response for children in the school, because most of the time when we are bringing one spot or one response for special education, at that time we lose the WASH facilities, the health issues, and the child protection issues. However, this ERM project has bringing together with these all multi-sectoral responses as a result, it strengthens the local capacity, because the different around 4 offices, experts from 4 offices come together and discuss on different thematic areas. And based on this, we have provided a training for the school leadership, the WAREDA Education Office, the WAREDA Women and Social Affairs, to bringing together and provide a training on different aspects like the referral pathways, the education in emergency, how to use the resources in the school, and how to manage these disasters and other psychosocial challenges of children and teachers as well. So that because of this, we are capacitating the local community with different teams at the same time at one stop. And on the other hand, that capacity will help us to easily, give these responses at the school level. So the ERM impacted on how to collaboratively respond to emergencies in the education system has also, the knowledge we learned as well as the local government learned from this, and they are able to, when we are, being in the field, they told us, you have given the way how to collaboratively work together in order to respond to different areas at one stop, so that this ERM has impacted on the collaborative work among different offices as one, and respond for a given challenges around the community. Yeah, over to you,
Great.
John.
Thank you, Tilahun. Thank you. Next slide, please. I will just keep this relatively quick, but our sixth key finding was that we found that additional support is still needed to meet the needs of crisis-affected communities. A primary issue that was raised was the desired continuation and expansion of the ERM, thinking about prioritization at the school level, expansion to other schools, as well as long-term funding, in terms of recognizing that there were limited resources and selection for the most vulnerable or those most in need, particularly around scholastic material distributions and school feeding, was required in order to make the most use of available resources, as well as the discussion around persistent needs in communities beyond intervention schools, though schools were selected in collaboration with the cluster in terms of where there were existing interventions or other activities, as well as based off of needs assessments and where the greatest needs prevailed, as well as long-term funding, showing the need to bridge the gap and the divide between emergency response into more long-term development in a post-conflict, but potentially still fragile context, and thinking about the transitions within those different phases of emergency response and ensuring coherence throughout. Next slide. And in terms of more technically, for school feeding, respondents were happy with the high energy biscuits provided, but many recommended moving towards hot meals that align with WFP standards to benefit the whole school. As previously mentioned, while MHPSS was integrated into the project, stronger PSS support was requested for both children and teachers, including a stronger focus on teacher well-being. Teachers frequently reported a desire for additional trainings, often on a regular basis, echoing evidence of comprehensive, continuous professional development. And some participants also recognized other sector areas that could have also been brought in to strengthen the multi-sectoral response, such as integrating peace building into programming or economic recovery and development activities, given the wake of the conflict and the effects of that. Next slide. And kind of our last finding was around barriers to implementation, and finding that insecurity led to some delays in road access, which then also was compounded by inflation due to the conflict, which then led to budget inflexibility and procurement processes that ended up causing implementation teams to have to make some strategic choices around what to procure, how much to procure, and how to do that in order to still reach goals. However, that did affect a timely response due to all of these access and or procurement concerns. And then in terms of coordination, while the PM-ERM strengthened a lot of the local capacities, especially around coordination across sector offices, there is still a need for stronger collaboration, particularly amongst implementing partners, given that this was implemented by 12 national and international NGOs to strengthen the coordination for timely implementation and to learn from one another in terms of successes and best practices. Next slide. A couple of limitations to this were that the quantitative data was obtained through government reports and not collected independently. So while we requested data gathered from schools to have certain criteria, we can't verify the authenticity and the authority of controlling this for an independent variable. So that's just a caveat on the quantitative analysis. The qualitative data was collected internally by IRC staff, so that may have led to positivity bias on the effectiveness of the intervention. I will quickly pass it over to Annie for some last recommendations and conclusions, but please add any questions to the chat or the Q&A.
Thanks, John. Can we change to the next slide, please? And one more. Thank you. So I know we're running short on time, so let me speed through this. First of all, we really believe from the findings that it's important to ensure whenever possible that our EIE responses address children's holistic needs through these kinds of multi-sectoral interventions. We know they're not common enough, but when we do see them take place effectively, we're able to see those, bigger impacts around health, safety, and educational well-being. We found that the provision of structural inputs, such as that classroom rehabilitation, complemented ensuring quality learning and holistic development at school. So it was the combination of the factors we believe that led to some of the great changes. We also believe that we need to integrate, or we can, not necessarily we need to, but you can integrate learning through play, or LTP, as an entry point for supporting teachers in crisis-effective contexts. We've seen that there's that positive influence on learning through play on supporting school attendance and retention for students and teachers, as well as those more positive interactions between students and teachers that lead to that improved sense of joy and well-being in a classroom in a conflict-affected setting. We also believe that we need to provide continuous support to teachers, and we need to prioritize their professional development, even in emergency contexts, and also provide material responses to them so that we can show that we're supporting them. We need to consider teacher well-being as an outcome in future EIE responses, which wasn't a major part of this intervention. And I think if we could go back, we would integrate teacher well-being more formally into our response. Finally, it's important to strengthen existing capacities and coordination mechanisms to improve communication in this kind of multi-sectoral synergies and this kind of multi-sectoral intervention, as you've heard from our participants, in order to support that transition from emergency response to long-term recovery. So those are our overall recommendations and conclusions. If you switch to the next slide, I think we're ready for some Q&A. We don't have a ton of time. We have 6 minutes. There are some questions already in the chat that are still open or in the Q&A box. I'm going to facilitate the Q&A. I will read a few of these questions and then hand them over to the panel. Before we do that, really quickly, I want to announce that we are launching the report and brief from this study. And I think John is going to drop those into the chat, or if you haven't already, so that everybody can access the fuller, longer reports that we've created as a result of this research. So quickly, looking at some of these questions, we've got a question from Aminata. How do we maintain well-being in schools that are in army barracks for children and teachers? As we know how thoughtful it can be knowing it can be a target for conflict or disaster during or before crisis. So that's one question from Aminata. Ricardo is then asking, were we able to address all of the CEL competencies, and how do we integrate CEL, or social emotional learning, in the classroom? Another question here is, will the mental health and psychosocial support, MHPSS support for teachers and children be sustained through local actors now that this project has ended? That came from an anonymous attendee. So those 3 questions, which have not yet been resolved, I will hand over to the panel. Does anyone want to get us started? Maybe Johannes, do you want to tackle this question around maintaining well-being in schools that have been army barracks for children and teachers, or that have been IDP shelters?
Yeah, so to reflect on that, the program is involving the system actors, teachers, and also the education system actors, and also the women and children affairs in the implementation area. So that would make a sustainability of this intervention. Also, we are out from the project.
Thank you so much for that response. Would anyone want to address this question around how we were able to address social emotional learning? Anyone want to jump on that? Maybe Talahun or anyone else from the panel?
Yeah. Thank you. Just to reflect on that, we are, in the core PlayMatters project, we are planning to transit all these the ARM schools into the core PlayMatters project. I mean, to relate this, just we have the training on psychosocial well-being for teachers and for the system actors, so that they are able to, understand what well-being is and how they practice in the classrooms for educators. This is already included under our content, and that will help for those teachers who are, informing about well-being and other issues related to psychosocial challenges, and then we will support them with providing trainings on teachers' well-being and students' well-being as well. Yeah, over to you.
Yeah, thank you so much for that response. And we have just a couple more minutes, so I want to see if anyone wants to answer this really great question on, will that MHPSS support that's been provided be sustained through any local actors now that the project has ended? Looking at that long-term sustainability. Anyone want to tackle that?
Yeah, actually, we have, organizing the exit strategies during the end of the project, and bringing all the stakeholders and actors, so that they are very aware of what had been done by the project, and they are, confirmed for us to continue these activities in the schools. And as usual, what we are doing is, while we are exiting from the project as a result of phase outing, we organize a kind of meeting with the local communities and the stakeholders, and then they capacitate them to handle the interventions, or the areas where we had already done at that intervention area. And then we are confident on the local government that they can continue on the sustaining activities what had been done by the project ERA.
Thank you so much. And I know we're at time, and I know we didn't have enough time for Q&A, so I apologize, but I think we did hopefully address most of the questions, either through the written or the oral conversation. I want to really take a minute to appreciate this panel of experts from the Emergency Response Mechanism in Ethiopia. If you can all just turn on your camera if you're able to, and so we can all thank you for your amazing work that you've been doing to reach children and teachers and families in these really challenging conditions in the conflict-affected parts of Ethiopia. So thank you for everything you're doing and everything you're doing to learn about how we can best serve these children. Thank you. And thank you for all the attendees who joined us today. Please take a look at the links that are in the chat that John added. There's a research brief, there's a study report, and some other information. And also, I think there's a survey from INEE they would appreciate you responding to, so that they can get feedback. So a huge thanks to both our panelists and our participants today, and have a wonderful rest of your day. Thank you so much, everyone. And thank you, INEE. Thank you, INEE, for hosting.
Thank you.
Thank you. Take care, everyone.